Okay, so for this evening, we're just gonna do a quick discussion group. I'm gonna read some questions, and I'm just gonna discuss the answers with you. Oh, here comes Maria. Let's hang on. We'll get Maria posted on what we're doing. Hi, Maria.
Hello, Miss Marsha. Good afternoon.
How are you, honey?
Um, so.
You're so. Well, I can't see your face.
Well,
There you are. I can see your face now.
Hello, everybody.
Hey.
Oh, look at the little princess. Oh, my
God. Isn't she beautiful?
Is it big? Oh, my gosh. Well, I changed my mind. I'm happy.
Oh, now you're happy? Well, what's going on? Is everything okay?
No, well, yes, thanks God. But I'm still having a trouble on the SIM chart. Doing. I was really good on number 58, but 59 don't let me go in there. When it's the point to touch true drug, it's thrown me to a different window and don't let me go in and said that be in contact with something. And I took a picture and sent it to Carmen, who is helping me. But Carmen today and yesterday, she is being so busy at work.
Right.
So, and she answered me and she said that it was pretty busy. I think she was with parent teacher or something like that. And I'm waiting. And like I said it, when I wasn't touching the true drug, I fixed it. When I was the point to add ICD-10, I fixed it and put the code, but throw me to a different thing. So I went to add the problem. But Miss Marsha, the thing is, said according to the book and the figure that I'm supposed to be, I see little difference on numbers. My screen said number 2, but the book said it's number 1. And I can go farther because I can't.
Okay, so why don't I flip my screen and we can go through, well, I don't know. This is an awfully big Sims chart. It's 112 steps.
Yes, it's a long.
Yeah, they don't get smaller, they just get bigger. They don't get easier, they just get harder.
It's getting bigger. I know, it's 112 points.
Okay, so would it be helpful if I flip my screen around and we go through the Sims chart one by one and we do it together? Okay, do y'all have your books handy so y'all can help me?
Yes, ma'am.
Okay, so I'm going to share my screen so that I can get into that and we can work our way through.
Yes, ma'am.
Oh dear me.
So it's just me who has behind on this, Miss Marsha?
Well, I haven't heard anybody else say that they had any issues. So, but that's okay. That can just be a computer glitch. It doesn't necessarily have to be you. But we can take the time right now to kind of go through. And I've not done this one, so it may take us a minute.
I do think that there was an issue with mine, but I just bypassed it and did what the book said. Because it kept popping up an error. It said that the ICD-10 code that you're trying to select, something about it not being able to be used. but it was what the book was telling us to use, and it was the most accurate ICD-10 code. So I just manually keyed it in the entry field.
Oh, you just manually keyed it in instead of using the true code?
Well, I used the true code to get the code,
Uh-huh.
but when I would click on it to automatically enter it into the SIMS chart, it was giving me an error message.
Okay.
So
All right.
what I
Well,
did was just take that code and put it in there manually.
okay. So we're on number 59, correct?
Yes, ma'am.
Yes, ma'am.
Oh my goodness. I'm not going to be able to.
Uh-oh.
I'm a teacher, not a student.
Okay, I understand.
It won't let me in.
Okay, no problem. Just I be waiting for my
Rachel,
my
can you?
instructor, Carmen.
Yeah, you can wait for Carmen, or Rachel
Yes.
can give you a holler and tell you exactly what she did to get you past that point.
Yes.
Call
Okay.
me. You have my number, right?
Yes, I did it. Yes, ma'am.
Okay,
Well,
call me.
Yeah, Carmen is not your only classmate, Maria.
Get out.
And
Now.
believe me, this happened
Now.
to us at her house, but I didn't pay really close attention in what she did it, but this happened before to us.
Yeah, the true coder can be a little bit tricky, but
Mhm.
unfortunately, it's not something that you just have to kind of work with it and get past it. And Rachel can share with you how she was able to put it in and work past it. Hi,
Okay.
Katrina.
Hi, everybody.
Hello.
I know I'm
Hello.
trying to make myself not
Hi,
be so.
Rachel. Hey, Maria. Hey, Miss Marsha.
Hi, darling. How are we doing?
All right, hanging in there.
Wonderful. We were
Good.
just discussing with Miss Maria. She had trouble on SIMS chart number 59 with
Mhm.
true code actually it was not allowing the code that they gave to go in.
Yeah, it did that to me too. Mhm.
Right. I was going to flip
Yeah.
the screen around and work through the SIM chart and we could do it together, but I can't
Okay.
get in the way y'all do because I'm a teacher and y'all are
Oh.
students.
Okay.
But
Okay.
And
silly
it's one
me,
of
didn't
the
realize.
largest.
Yeah.
Huh?
It's one of the largest chart that we have, probably because it's 112.
Yeah.
It is a lot. It is a
Well,
lot.
well, if y'all have any trouble, like Rachel's already worked through it and figured out how to fix it to get past it. I think she just worked with it until it let her do it. But,
Okay.
just reach out to each other. And I can do some stuff, but actually getting in and working the SIMS chart, unless I go in as a student, I can't do it for some reason. So, darn, I can't go through all 112 steps with you tonight, Miss Maria. I'm so sorry.
Oh.
It's okay. That's okay.
Oh, okay. But what I did prepare, I wanted to touch base and just see all of your faces and say hello and say what a great job you're doing and ask if you enjoyed the medical terminology.
Yes, yes.
Yes.
Yeah,
Bring
something a
back
little
memories.
bit,
Yes.
ma'am.
I said, bring back memories.
Yeah, brings back memories. I just thought some of you have had medical terminology. Miss Maria, I know you've had a lot of it because me and Miss Kim are very medical terminology oriented.
Yes, ma'am.
But so I'm trying to weed it back around because these SIMS charting, you guys are getting them done so fast. So I just thought I would add a little bit extra work. But I thought tonight we would just kind of discuss some questions. And it's going to be kind of questions like the first one is, why is it important to document a patient's surgical history? Now, the reason I asked that question is because one of the SIMS chart that you did this today was about surgical history, right? It had some surgical history. So I thought we would just discuss why it's important to actually document a surgical history. What do you guys think? Why do you think it's important?
Very important. Even from the time of the procedure, the name of the procedure, even from that point, it's very important. Having all the information as far as the patient name, date of birth, age, weight, all of that. All of that is very important in the type of procedure. So you won't mix up, and do the operation on another patient that's not the patient that, you're supposed to.
Right.
Operate
Well,
on.
that a complete and accurate history is the foundation for all
Mhm.
future patient
Patient
care.
care. Mhm.
Do you know when you go to the doctor, they say, have you had any surgeries? Have you had any
Mhm.
procedures?
Mhm.
Because, for example, I've had a gastric sleeve surgery. Well,
Mhm.
that's going to be on my record forever
Okay.
because say that I'm suffering from anemia and I have to go see a hematologist, which is a true thing for me. I suffer from severe anemia now. Because I had bariatric surgery that exacerbated that condition, and they have to know what caused that, so they know how to handle me in the future because that history always dictates the future. Abby's so cute. Okay, so I'm going to ask another question. Why do you think chief complaint or CC is important?
Because
Marie?
let the doctor know what's happening at the moment with the patient.
Very good. It's what you're presenting to him or to the staff with. So it's those signs and symptoms, and it's commonly referred to as presenting problem because you're presenting the problem, and they can often tell just by your the way you're carrying yourself or visually see some symptoms. It guides the diagnoses, which guides the decision making and what kind of care they're going to give you. It is also vital data that the public health system used for monitoring the outbreak of diseases, which is something that we really don't think about, right? So how do you think they're getting all of these national numbers for COVID?
through the doctors, through the what you call it, the CDC.
The CDC, yeah, but
Mhm.
they're getting it from the codes.
Oh, yes,
Right.
that's right. Mhm.
They're
That's
getting
right.
it
From
from
those
the
codes.
codes.
Yeah.
You know, you think about, let's just put COVID out for a minute, which that's, we're looking at huge numbers. Well, how do they know those numbers? Because there's coders and billers out there coding it and billing it. So they're capturing those numbers as they go through the system. But you stop and you think, how many hepatitis B patients were died, or how many hepatitis? Oh my goodness, let me think of my words. What's the percentage of the American population that has hepatitis B? Well, how would they ever know that? It's through our diagnosis codes. That is a huge world impact. And the same thing with HIV and all the different things. So it's really fun to think, or it's neat to me to think that we really do have a global impact with what we do. Okay, so our third question is on SIMS number 47, you added lab results, preventative services, and preventative services. Can you think of a few examples of preventative services?
Pap smear.
That's that's not on my list, but that is one. Rachel, give me the one that we don't like. The one that we discuss, but we don't discuss.
Vaccinations.
There you go.
You don't like vaccinations?
Not all of them.
No.
Not all of them, yeah. But we reserve the right for everybody to have their own opinions.
That's right.
So
That's
wellness
right.
visits are preventative when your doctor asks for you to have a wellness checkup for your children. Screening for blood pressure, cancer, cholesterol, depression, obesity, type 2 diabetes. And there's pediatric screenings, which can include hearing, vision, autism, and developmental disorders. So those are just a list of some of the preventative visits that we may have. Okay, I have another question. Why are putting patient orders in correctly an important skill? Well, I'm just going to tell you a story while you think about it. I used to be a secretary on the 4th floor at Rapides Regional Medical Center, and Dr. Hajmarad was a very, very popular neurologist on that floor, and he was also the only doctor in the hospital that did not put in his own orders. Guys, it looked like he took a chicken and dipped his feet in ink and let it run across the paper. That's what Dr. Hajmarad's orders looked like. So I developed a Dr. Hajmarad alphabet where I literally put his hen scratch, because a lot of times orders are kind of the repetitive things, you know, like blood panel or this or that. So I actually made a little a binder, if you can believe it. I'm a binder lady. I love it, of his alphabet for him so I could put his orders in. But it guides a clinician while treating a patient to ensure that they do not miss any critical components of care. So your orders, for example, if you give a patient orders to go have lab done at the outpatient center at RAPPs, and they need specific panels, but you do not correctly enter the order, and they don't do the panel that the doctor specifically needs, well, then what happens? They have to go back again. So you guys know, I don't expect that any of you would put orders in incorrectly, but I just thought it was a really good question to ask, because we never really think about those smaller components that make our job so important. So if it's your job to put orders in, if you cannot read them or you do not understand, please always ask, because asking is the best thing to do, rather than to say, oops, I'm sorry, we got to do that all over again, because the patient's not going to be happy and the doctor's not going to be happy.
Right.
Okay, and I just have one more that's kind of fun, because we talk a lot about vitals in our SIMS charting, right? Lots of documenting vitals and what have you, but do you know what vitals are normal? Do you know what a normal blood pressure is?
Is it 120 over 80?
Yes, ma'am, Miss Katrina, that's right. So I'm just going to go through a basic vital list, and I'm going to give you what's normal.
Okay.
Because I think, because when I looked at these numbers and I started looking, I said, some of these I don't remember. So I just said, you know, that's something that I think would be important to know. So a normal blood pressure would be 120 over 80. If you have anything over than that, then it's considered high blood pressure, right? Now, there are levels to that. When you go to the doctor and you're nervous and they take your blood pressure and it's a little bit elevated, what do? They sit you in the room, they let you calm down, they give you they may give you a little water, and then they take it again, because high blood pressure is very serious. They take that very seriously. Okay, so blood sugar. Anything over 130 is high. I knew that one because my son's diabetic, but his sugar runs high just normally. So anything over 150 to him is high. Sometimes when he gets around 75, which is like the sweet spot for most people, he gets shaky and he doesn't feel well. He needs his to run between 100 and 130 is where I like it to be. So, okay, what's a normal body temperature? Can you believe I did not remember that? As many times as I've taken my kid's temperature, I didn't remember. It's been a long time. But it's 97.8. Or I thought, well, they had it listed as 98.6, but I've always thought it was 97.8.
Me too, 97.8.
Well, we're just going to say anything in that range is okay. I took my temperature with the little thing this morning at school. It read like 93.7. I was like, oh, wait a second. That can't be right.
That's low.
So I don't know. You know those little things that you take your temperature with, you shoot? I'm not sure how accurate those things are sometimes. Anything over 104 is fatal. But I have to tell y'all, I'm going to be completely transparent on my paper. I wrote fatal is 140 degrees. It's 104.
Yeah.
You made it at 140.
We know what you meant.
Okay, so a normal pulse rate is 60 to 100 beats per minute. And a respiration rate is 12 to 16 breaths per minute. So those are our normal ranges. I just thought, I kept thinking today, what would be something that would be good information to have? And I said, I think this is really good, because how often do we research what the normal range is?
Mhm.
And, kind of keep that in our back pocket to remember. I may not remember next week, but I have it written down in my notebook, so I can always refer to it.
Mhm.
So that is our little discussion this evening. I'm open to discuss anything or answer anything you guys may need. If you just want to chit chat and visit, I'm okay with that too.
Thank you,
I'm a-
ma'am.
Yes, ma'am. Thank